All right, today we're looking at biohazards. The definition of biohazard, biological hazard, is taken to mean any viable, that means living, infectious agent that presents a risk or a potential risk to the well-being of humans. Biological agents are living things or substances produced by living things that can cause illness or disease in humans. A lot of our bacteria and stuff actually doesn't come from the, oh, hey, it gets brighter. It doesn't actually come from the agent itself, but from the byproducts, if you know what I mean, of these living organisms. So in order of commonality, the routes of entry for your biological agents are inhalation, ingestion, and then absorption through the skin. So inhalation, you breathe it in. Ingestion, you eat it. And absorption through the skin, as it says, it just seeps in and gets into the membranes from the outside. Different types of transmission. First is direct transmission. This takes place when there's actual physical contact between an infected and a non-infected person. Then you have less common, the indirect transmission. This takes place when an infectious agent attaches itself to materials or object, or when an insect or air transmits the infection. So someone doesn't wash their hands after going to the bathroom, they grab that door handle, you come by and you grab that same door handle even after washing your hands. Guess what? You could be contaminated by indirect transmission. All right, some biohazards. HIV, AIDS. We're also going to look at hepatitis, tuberculosis, molds, influenza, and the common cold. So first, HIV and AIDS. The HIV stands for human immunodeficiency virus. AIDS is the acquired immune deficiency syndrome. It's transmitted from an infected person by bodily fluids such as blood or urine, semen, or other blood-containing secretions. The key element here is blood. The urine and semen, these secretions will only carry it if there's blood present. It is estimated you have like a 0.4% chance of catching it from anything other than, directly blood. So if it's directly touching blood, you're going to have a problem. And this is why we spend so much time with the custodians learning how to clean up these biohazards. There's a very specific way that you do it. So you're on campus, you see some blood on the ground, don't touch it, don't try and clean it up. Call the custodians, they've been trained in it. And all their, all right, so there is no cure for AIDS, and the end result is death. They have cocktails that are supposed to help keep you going, but so far nothing effective. Human immunodeficiency virus is thought to be the cause of AIDS by invading helper T cells, which are supposed to actually prevent you from getting sick. HIV weakens the immune system and leaves the infected person open to deadly infections. There's more fun information about the T cells and whatnot. Infected individuals 13 and up. In the U.S., there is currently an infection of 1.1 million. This is actually down from 2014, which was 1.2 million. The USA annual new infections are 40,000 as of 2016. In Texas, as of 2014, there's 69,000 infected. In Dallas, currently 3,000. Texas is not in the highest, but it's second highest. Not as far as states, but as far as infection rates. California is higher rate, but Texas is way up there. In fact, most of these diseases that you get, HIV, tuberculosis and stuff, tend to live down here in the South and are spread more in the South. So prevention, always use PPE. There is antiretroviral medication that you take within 3 days of a possible exposure called post-exposure prophylaxis. It may reduce the chance of becoming HIV positive. Some people of European descent are immune to HIV. There's a whole program at PBS that you can watch on how they discovered that. It was when they were searching for survivors of bubonic plague that they realized that there was an association, and some people are actually completely immune. HIV and AIDS, the risk of FPO staph is minimal. Nevertheless, because it's deadly, you want to be aware of it and you want to take proper precautions. And what's your biggest precaution? PPE and wash your hands. So if you have any question about any kind of these biohazards, the answer is always going to be PPE, wash your hands. All right. Hepatitis. Hepatitis is an infectious liver disease caused by viruses. It could be hepatitis A, B, C, E, or what's called delta factor. Some have no long-term effects, and some can be downright fatal. Possible symptoms, basically your flu symptoms. With the exception of the showing up of jaundice, most of these are going to be things you might see in, when you have the flu. Adults and teens will have symptoms more often than young children, but not everybody has symptoms. You could be carrying this stuff around for quite a while and not even know it until it just deteriorates your liver. Treatments. New treatments have become available. Check with your doctor, but usually if you get one of the more serious ones, you're going to need a liver transplant. Over time, your liver might stop working. You might need a new liver from a donor. Hepatitis C is the #1 reason for liver transplants in the U.S., and that is one that in the last few years they've come up with some treatments that are actually quite effectual. Hepatitis A, transmitted by contact with affected feces or contaminated water. That means if you work anywhere near Swiss Tower garbage cans, you're going to be exposed. No chronic or long-term damage, usually not fatal. Prevention is the immunization and your proper PPE. There's 125,000 to 200,000 hepatitis A infections in the U.S. every year. Since there's no chronic or long-term, we don't typically automatically immunize you here at DTS for it. See, ways to prevent hepatitis A infection. The immunoglobulin preparation contains hepatitis A antibodies. They can be used for exposure to hepatitis A and within 2 weeks of exposure to infection. It's good for all age groups. Best prevention, PPE and wash your hands. Exactly. Wash your hands after using the toilet, changing a diaper, preparing or eating food. Wear gloves if you have to clean surfaces contaminated with stool. The reason why HIV is prevalent in the southern states is it's typically passed in schools. It has to do with poor hygiene from people who are handling food services. Typically, we have a lot more than in the north folks that come from areas that do not press good hygiene. And so that's risk to staph is moderate, again, because a lot of people work with the trash and the baby changing stations, etc. Hepatitis B and C are a little more virulent and they're a little more destructive. They're found in the blood and body fluids, semen, vaginal fluids of an infected person, again, when blood is present. Average incubation period is about 16 weeks for hepatitis B and 7 to 9 weeks for hepatitis C. This is important because it means you could be carrying this stuff for a while, not even know it, and transmitting it. So your precautions have to be proactive. You're touching trash, wash your hands. Don't assume that you're still good because you could be carrying it around for weeks and not even know it and spreading it. So there's injection drug use is a problem. Sexually with an infected person, sharing items like razors and toothbrushes, things that again will cause blood to show. Tattoos and body piercing, and you can get it. A child can get it from their mother at birth, or and then again, not using proper PPE. Hepatitis B specifically, transmitted through blood and body fluids containing blood. It's much more infectious than HIV, and it can live, this is an important part, it can live in dried blood for up to 7 days. So you might think that, oh yeah, this has been sitting, no, it could still be infected. Chronic long-term effects, well, death, and not just possible, but probable. Because this is, even though it's not as common, Because the results are so bad, DTS does provide hepatitis B inoculations free of charge for those that are working in those areas. So prevention, immunization, and proper PE, both provided by DTS. 140 to 320,000 annually infected by hepatitis B. Why immunize? I just went too far. Come on, go back. Well, suffice it to say, you immunize because OSHA says so. That was basically what that slide said. Risk to FPO staff, minimal to moderate, so not as much as some of the other ones. Hepatitis C, transmitted through blood and body fluids, again, mostly chronic long-term effects. Cure is a drug cocktail, and there's new treatments available. Some are very effective. 36,000 cases of hepatitis C develop annually, and that's the one that you're definitely going to have to get a liver transplant. So risk minimal. For more information, go to the Centers of Disease Control. You don't even have to type in the hepatitis one. It'll take you right there. All right. Y'all got that? cdc.gov. Easy to remember. Okay. It's as easy to remember as dts.edu. Tuberculosis, transmitted only through air from exposure to cough, sneezes, or other tiny droplets coming from the lungs of an infected person. Can be treated very effectively through a combination of pills. They're not really fun to take, I'm told. Prevention, yearly testing and general awareness of those around. So basically your prevention is, stay 8 feet away from people who are coughing and sneezing. Yearly testing doesn't actually prevent it. It just lets you know that you have it so you can start the cocktail before some bad things start to happen. A bad cough that lasts 3 weeks is a good symptom that you might have something. Pains in the chest, coughing up blood or sputum, weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. A lot of these things also are similar to the flu. Basically, anytime you have a sickness that lasts 3 weeks or longer, in our house, it's past a week. If it goes past a week, we take our kids in to see the doctor. The sputum, you have different color. If it's clear or milky, then it's still okay. You go to brown or green, it's time to go to the hospital. So coughing up blood is never good. Just saying. Here's your TB cases. You can see they're on the slide. They're going down, but you also see that most of them are down here in the lower states. 1/3 of the world's population is infected with tuberculosis, but not many of them are here. Of the 9,287 cases reported in the U.S., 1,250 were here in Texas. That's a 1 to 9. So we get a lot of them. Florida, California, and Texas. Molds. Presence of mold does not always mean a health problem. Remember, we had that black mold scare back, and everybody was calling their insurance company, and everybody's insurance rates went up, and it turned out most of them weren't anything to be worried about. Mold is everywhere. It's here right now. It's living in the walls and stuff, but by keeping the moisture out of the air, by keeping the temperature moderate, the mold just stays dormant. I mean, it's in the air, so you can't avoid it. But you get some really nasty mold. The ones, they all produce mycotoxins, but some of the mycotoxins that are produced aren't as toxic to humans. But over time, it can wear down the immune system, produce allergic or respiratory problems. Some of these are very severe. So prevention, you keep moisture from remaining in buildings, periodically do a visual inspection of the facilities, and call the custodians to work on mold eradication. They have a system in place. Yes? Yes. All right. Mold abatement should be done as soon as possible upon discovery, mainly because it's hard to tell sometimes which one's the good mold and which one's the bad mold. Some mold used to make cheese. I mean, come on. Mold you get penicillin off of. Good mold. Influenza. Where are you? There you are. Transmitted through the air from exposure to cough, sneezes, or other tiny droplets coming from an infected person about 6 feet away. Just for safety, make it 8. Less often by touching a contaminated surface or object when touching their own mouth or nose. So Try this sometimes just as a trick. Try to consciously think about every time you touch your face. You'd be surprised how many times a day you touch your face and don't even realize it. Once you do, though, and you think about all the germs that you're passing on, you might actually make it a habit of not touching your face as much. I try and keep my hands in my pockets more, except when I'm walking, slips, trips, and falls. Pay attention to that. Okay. Spread. Adults may be contagious a day before symptoms and 5 to 7 days after becoming sick. So you're feeling better, come back to work. Not necessarily. Talk to your supervisor. Make sure that you're not spreading your disease a couple of days after just because you're feeling better. Children may be contagious for more than 7 days. Swiss tower, anyone? Symptoms start 1 to 4 days after infection, which means for 1 to 4 days after you're infected, you may not even know it, but you could be spreading things. That means you may pass on the flu to someone else before you even know you're sick, as well as while you're sick. Some people be contagious. Okay, work on grammar there. Without symptoms. Some people can be. More symptoms? Fever. Feeling feverish, chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and vomiting or diarrhea, more common in children. Not everyone with the flu will have a fever. That's a misnomer. But as you can see, these are very similar to the flu. The joke being that I just said that on, never mind. Okay. Tough crowd today. What is going on? We're just tired? Wore out. Yeah, going fast. All right, so sneezing, coughing. What do you guys do? There's a pop quiz for you. What do you do when you cough or sneeze? You cover your mouth?
No, not your hand, because then you'll touch something.
There you go. Some people use this. Yeah. I like to, go in here, into my jacket, coat, because I don't touch anybody with that, So yeah, here or in there. Yeah, just keep it out of the air. Because, I love you dearly, but I don't need your... Okay. Prevention, get vaccinated. Stay home if sick. Yeah, it's dancing. Stay away from sick people. Wash your hands often with soap and water. If soap and water are not available, use the alcohol-based hand rub. Clean and disinfect frequently touched surfaces. The soap and water is your best prevention for anything. Okay, soap, because you lather it, and then when you rinse it, it goes away. The alcohol-based hand rub is good, but you rub it in there, and it may kill whatever it touches. Okay, but you don't necessarily always get it everywhere that it needs to go. Best, wash your hands. The vaccinations, there are 4 main flu variations, but there are thousands of subspecies of them. Some people still get sick after taking the flu virus, some afterwards. There's a big, controversy around that whole thing that I'm not going to get into here, but if you're curious, we can talk about it later, tell you the pluses and minuses of it, and let you make your own decision. Clean and disinfect frequently touched surfaces. You guys do a good job of that. Yes. All right, influenza-like illnesses. Again, you see how much of that is in the southern states. I think it's because of the nice warmth. All living things like to go toward the warmth. There's your activity level, and you see in Texas, it's really high. It's really high. In Oregon, they don't have any, probably because they don't like the rain. All right, I'm from Oregon, so I can say that. Risk to FPO staff, very, very high. Why? Because we're touching a lot of surfaces, and we're getting involved with a lot of folks. Common cold, over 200 viruses can cause the common cold. Most common is the rhinovirus. There's another one that hit our family. It's like the nanovirus or something like that, and it laid both Anthony and Carolyn out for a good 24 hours. Virus transmitted by getting into the nose where the infects the membranes. If not properly treated, can directly cause laryngitis, tracheitis, bronchitis, sinusitis, or pneumonitis. It's not fatal, but sometimes, it severely affects the performance and absenteeism. And even though we like the dancing, stay home, We'd like it better if you don't get it and stay working. There are 61 million cases of common cold a year in the U.S. A person can have an average of 4 of these per year, mostly in the wintertime, but you can have colds during the summer as well. Prevention, washing hands, covering your mouth when coughing or sneezing, not with your hands. Wiping nose using disposable tissues, not your hands, or your friend's shirt. Healthy diet, sufficient sleep, avoid rubbing eyes and nail biting or touching your face in general. All right, risk to FPO staff, very high. So review, biological agents are living things or products, byproducts really of living things. They can enter the body through inhalation, ingestion, or absorption through the skin. Infectious agents are transmitted by direct physical contact or indirect transmission. Biological hazards may be controlled at the source along the path by cleaning and waste disposal, or at the worker by means of PPE and immunization problems. You ever watch somebody making your sandwich and you're just like, shouldn't you be wearing gloves? I do that all the time. I'm like, seriously. Final note. 2004 revision of OSHA's bloodborne pathogen standard says that we have to have a needle stick program, which we do, but you come across some sharp objects, use extra precaution. If they're needles, definitely let the custodians handle it. You get razor blades and glass, wrap them up, tape them. The idea is that we want to keep everybody's skin closed, because even though you know you don't have anything, you don't want somebody to get poked, cut, or sliced that will have something drip all over the place, and 6 days later someone runs across it and gets a hepatitis. Quiz time. Any questions before we have the quiz? Nope. All right. Quiz. Anybody need more time for their quiz? I do. I haven't done mine yet. Okay. All right. You shout out the answers and I'll write them down. Yeah. Yeah. Okay. So biological agents are living things or substances produced by living things that can cause illness or disease in humans. True or false? True. That is true. Ingestion, eating, is the most common route of entry for biohazard. False. False. What is? Inhalation. Yeah. List 4 of the 8 biohazards discussed today. Yeah. Hep A, B, C, and E is good. So, there are only 1 million adults and children in the world who are infected by HIV/AIDS. False. The DTS FPO staff has the highest risk of contracting which of the hepatitis viruses? Ooh. A, very good. Let's check. Influenza is a biohazard that can be transmitted through which of the following means? Circle all that applies. Is it A? Yes. Is it B? Yes. No. Influenza from blood? No. Is it ingestion? Can you eat influenza? No. How about indirect contact? Yes. Yes, the flu is brought on by inhalation and indirect contact with things that have been contaminated with, like, spit. Tuberculosis is a biohazard that can be transmitted through urine. True or false? And molds produce mycotoxins, which over time wear down the immune system of the human and produce allergic or respiratory problems. True. How many colds will the average person that lives in the USA have a year? 4. What is the best way to prevent the spreading of infections? Washing your hands. The other best way is to keep them away from you by using proper PPE. That's fantastic. I thank you so very much.